The advantage of the IQon is we've always got the spectral data.
Always on means more diagnostic confidence for me with low contrast doses and less time on the table for the patient.
Always on is probably the most important advantage of the IQon compared to the other vendors. Because you never know in advance if you need spectral qualities or not. So it's really a big advantage to have it.
The most important thing for me as a radiologist is basically to get the diagnosis right.
What gives me confidence when working with IQon? Well, it's the ability to retrospectively manipulate contrasts and pull up additional information when needed. The great thing is that you don't need to think about upfront whether or not you want to have all this information available, because it's encoded in all of the images that we obtain. And once you need it, you can simply pull it up with a couple of mouse clicks.
I want to have a CT scan that is of diagnostic quality at low dose to the patient that allows me to turn around to the surgeon or physician that has referred the patient and say, this is a diagnosis.
With spectral data, we increase the confidence because we have more information, and we can, for example, remove iodine, we can calculate the iodine content, enhancement, so we are more sure of the diagnosis. And sometimes when you miss injection, by playing with mono E, you can increase the contrast level, and even if you miss your injection, you can do the diagnosis in most of the cases.
Much more interesting out of my view now is actually the use of contrast agents. So we always talk about radiation dose, but we also have these risks which come from using iodine, for example, in CT. So, and I think there's still a lot we can do to reduce this.
CT is basically measuring the density of different tissues. But now you have at least 7 or 8 different contrasts encoded into the information that come with the normal CT pictures.
Every little bit we can also reduce there by being aware that we still get our image quality, I think is a big add-on. And I think this is also something which we now start to really do with spectral imaging, something which wasn't on the ideal list in the last years before this.
We do a lot of spectral CT in emergency situations. Before, I think we recall patients when there is a missed injection, and now it's very, very rare we have to recall a patient to do a re-injection.
One of the things you can do with this system is you're much more confident in the diagnosis of, for instance, incidental findings. There are many examples that we can think of, such as renal cysts, which can be evaluated now using spectral information instead of sending patients to other examinations. We've also seen very useful applications, for instance, in assessment of pulmonary embolism. We can pick up small perfusion defects in the lung without the need for, or as incidental findings that would otherwise not be recognized.
Self-confidence comes from the image quality that we get. And what we found with the IQon and being able to use the spectral data that we have, it just gives us a bit more reassurance when you're reporting the scans.
Because we get the conventional image, so some image which we got the last 40 years from CT, we're very, very confident in using the system because you don't have to look for something you never saw before. You always have your original image, or that's what you're used to, and you have these add-ons. So I think this is a great feature of the system.
And that's what I love as a radiologist. I'm a simple person. I like simple things, and being able to be able to pick things up very quickly, but be able to do so much with it, has always been a major advantage to me.
So I think once you see what a system like this can bring for you in daily routine, all of your future systems are likely to have this technology on board.